Hi, I'm Simon from Macquarie Street Physio. I wanted to talk to you about dizziness and vertigo. This is one of the conditions we treat here, and I wanted to try and give you some information on what might happen if you come and see a physio because you've woken up with dizziness. So you've woken up, the room's spinning, or you're feeling quite lightheaded, and you think you're not sick enough to go to the doctor, but you've heard about physios and physios treating dizziness and vertigo. So you come and make your appointment. When you arrive, we're going to go through a series. We need to get your medical history down, and we need to understand that there's nothing concerning happening. So we're going to ask you several questions that deal with, do we think there's a problem with the brain? Do we think there's a problem with your heart, sugars, blood pressure, all of those things. Once we're satisfied those things are okay, we'll move into an exam. And our exam has three main components. We want to know how you're balancing and moving in the world, so we'll look at balance exercises and look at your gait. We also really want to know what's happening with your eyes. Your eyes are a real gateway to what's happening with your vestibular apparatus. We'll do a series of eye tests and a series of tests that look at some reflexes between how your head and your eyes move together. And then lastly, we might do some very specific tests that look at the particles in the vestibular apparatus. So here we go, we've got a vestibular apparatus. So this is where your ear sits, and this sits behind it. And we often get conditions with the canals here, with the particles falling into the canals, and this is called BPPV. And it's one of the most common conditions we treat. So we've got some tests to assess how the particles move through the canal and see whether you're dizzy. So once we've looked at all of that, we can then go on and treat. And we treat this acutely on the day that you come. The other most common cause of dizziness and vertigo is vestibular migraine. So that's a migraine that produces a vestibular response, a vertigo response. We can treat that. There are other conditions like infections that affect the nerve here. We do treat that, but not when you're acutely sick. So that's normally you're profoundly dizzy for 2 to 3 days. So in that phase, we would keep you quiet and not really do a lot of treatment. But after that time, we would work on balance and eye reflexes to improve the recovery of that nerve. But up to 30% of people that present to A&E with vertigo or dizziness leave without a diagnosis. But it's still worth going and still worth coming here, because what you learn is that you don't have anything concerning wrong. There's no major cardiac issue or brain-related issue. And that these conditions that we can treat, it's not one of those, but things often resolve over 2 to 3 days. So if we have someone like that, we would recheck in with them in 2 or 3 days, make sure that they're okay. And if we're concerned, we'll write to your GP.